Working in a northern or remote community definitely has its challenges. There's geographic challenges, so you're quite a distance away from other resources. Transportation can often be an issue. Weather issues really compounds things.
It's not as though you have 3 regular flights from Vancouver, for example, to a remote community. Sometimes you have a flight once a week, and in certain times of the year, maybe it's interrupted.
Some of the other challenges, of course, are resource limitations in terms of staffing, in terms of the actual supplies that we have and the equipment that we have. Wi-Fi and access to the internet can be a big barrier to care and to living in some of these communities. When you really see worse health outcomes for folks in the north and in rural and northern communities, it's heartbreaking and it doesn't need to happen.
Connectivity in today's modern world is essentially like oxygen, essential to be able to close that equity gap and to be able to provide access to services for all First Nations people. First Nations Health Authority is here to serve the 155,000 First Nations people in BC with a mandate to deliver health and wellness services.
My practice is probably about 95% First Nation specific. I'm a family physician, so I provide care to Karisakani Family Services, mostly Yekuche and Takla, and go to Clayton Tenay as well. Our philosophy, for the most part, especially with Karisakani work, is that you do work in person, but then we can complement it with virtual services.
As a brand new grad, it's always a little bit nerve-wracking to think about starting full-time in a very rural or remote community where you feel like you're going to be quite isolated. Access to this technology, it really opens up the doors, and I would say that there's a lot less hesitation now. Even in our residency program, we actually get training in how to use this RTVS system in sim labs. So having that comfort and the confidence to use the technology is really key as well. RTVS stands for Real-Time Virtual Support. It's new. Physically, it's a tablet on a roller. So the doctor on the screen can basically see everything that's going on in the room, and they can look at labs, they can help you with your procedures, they can look at the ultrasound as you're going and kind of help you through some of that. And they have special lines. So there's an emergency line where I can talk to an emergency physician who will walk me through any type of critical care, and it's just immediate. So the docs on the other line, they are on call for this service. They're not doing anything else.
We look at technologies to basically prioritize health-related traffic versus other types of internet traffic. So those are some of the things that we do in partnership with Northern Health from a technology perspective.
Before, people used to have like textbooks and going through textbooks and try to find some resources. Now you can actually have a video conference through Zoom, and then you have the specialist right there and they can see stuff in real time. And sometimes it's just nice to have a second opinion. People really see the need for that kind of virtual support because it is a little bit daunting when you're the only family doc in a small community. Virtual support has been like a game changer, I promise you. And it just makes access that much easier to have people in real-time care, because if not, they will drive an hour and a half to go to the local emergency department where a lot of things we can hopefully try to deal with in a remote setting.
Through connectivity, we can increase access to virtual services. We can do consultations, diagnostics, follow-up, monitoring. All of those things can be enabled through connectivity, drastically improving the patient experience.
The difference between a community that doesn't have access to internet and one that does is really, it just comes down to safety for both the community, the patients, and for the people working there. This technology, it allows us to connect with a stable care provider who knows the patient and the community very well, even if that provider is not always physically in the community. So I think that consistency and that relationship piece is really, really key.
So our vision for the future is to basically allow individuals to gain access to their health information, all of it, in one place, ideally on their mobile device. And we're investing in technologies alongside the provincial health partners to enable those services and explore where we can deploy them in the shortest time as possible.